So osteoporosis can be called a silent disease because you don't feel your bones thinning. But I want to be able to find a cause if there is one specifically, and then treat somebody with osteoporosis to prevent that fracture that could be life changing. So what is osteoporosis? It is the decrease in density of the bone over a period of time. And the common time for women particularly is after the menopause, because estrogen is a hormone which is important for maintaining bone. And after the menopause, the estrogen levels fall in women, and therefore there is some usual loss of bone. And the degree of that depends to a large extent on the genetics associated with that particular woman. So a woman who is small boned, thin, fair skinned, blue eyed is more inclined to have osteoporosis than a woman who is larger boned, who is more dark skinned, and is maybe associated with a more southern climate than a northern part of the world that they came from. So those are the characteristics of women with osteoporosis, and men get osteoporosis too. So 20% of osteoporosis patients are men, and there are different reasons for men to have osteoporosis. One of them is lowering of testosterone. Another one is some diseases that are associated with osteoporosis, which can be true for women as well. So those diseases are hyperparathyroidism, which is the enlargement of one of the four parathyroid glands. That can be a cause of osteoporosis. There's some other medical conditions such as multiple myeloma can cause osteoporosis. Cushing's disease can cause osteoporosis. These are less common conditions. And then once that is determined that one has osteoporosis, then there's lots of treatment options. And I think there's some concerns about some of the treatments, but the bottom line is that they all prevent fractures. And fracture for a person, particularly as they become older, can be devastating from a lifestyle perspective. It can change one's life in terms of their ability to perform their usual activities, change the place that they may live as a result of not being able to go upstairs or having the ability to take care of themselves on a usual basis. So our goal in all treatment for osteoporosis is to prevent those fractures. And the treatment is available. It's relatively easy to obtain, and for the most part, have few side effects. So I'm a strong proponent of treating people who have osteoporosis and being consistent with that treatment as well, and to follow through and to get looked at. So if you have a low bone density, or if you've had a fracture, so a hip fracture, a compression fracture of the spine, or a wrist fracture are diagnostic of osteoporosis, because those are the places that people get their fractures, and those people by definition, particularly in the postmenopausal woman and the older man, those conditions are usually related to osteoporosis and can be treated to prevent further fractures. So if someone hasn't had a fracture and doesn't know they have osteoporosis, how do they find out? Well, the most obvious way is to do a bone densitometry, or what we refer to as a DEXA scan. And that scan is done as a screening. Different organizations have put out different recommendations about screening for osteoporosis. So I'm not going to get into those details because there's a lot of differences among different groups. But the bottom line is that a DEXA scan is the way to determine whether you have osteoporosis. And you won't know it if you don't have because you don't have symptoms until you get one of these scans. And so they're underutilized most of the time. And we need to, if you're part of a general physical on a routine basis, your primary care physician should at least discuss the issue of a DEXA scan and consider getting that scan. And then if there are abnormalities, then dealing with that as a result of the findings on the DEXA scan.